Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hey everyone, I'm your guide to all things health, and today we're diving into the world of magnesium citrate, your ally in addressing various health problems. Let's get started. First things first, what is magnesium citrate? It's a medication commonly known as a saline laxative. It's primarily used to clean out the bowels before surgeries or certain intestinal procedures. Now, you might be wondering, when is magnesium citrate prescribed? It's often recommended for conditions like constipation, to prep bowels for surgical or diagnostic procedures, or even sometimes to flush out toxins or medications from the system in overdose cases. So, how does it work? Magnesium citrate increases the amount of water in the intestinal tract, which stimulates bowel movements. Simple, yet effective. Moving on to dosage and administration, this is crucial, folks. The starting dose for adults typically ranges from 195 to 300 milliliters, mixed with a full glass of water. It's vital to follow the specific instructions given by your doctor to avoid complications. But what about side effects? The most common ones include stomach discomfort, nausea, or diarrhea. Remember, it's essential to discuss any pre-existing conditions with your doctor, as magnesium citrate can interact with other medications and conditions. Beyond its uses as a laxative, magnesium citrate has other notable benefits. It aids in muscle relaxation, which can be beneficial for those experiencing cramps or spasm. It's also crucial for bone health, as magnesium is an essential component in building strong bone. And let's not forget its role in energy production, helping combat fatigue and improve physical performance. In conclusion, magnesium citrate is a powerful tool when used correctly. Always make sure to follow prescribed guidelines and consult your doctor if you have any concerns. Stay safe and informed, and cheers to your health.
If you've made it this far, let us know in the comments why you're using this medicine.